If you have an L4, L5, or L5S1 disc herniation or disc bulge, and the treatments or exercise that you've been doing or have tried have not fully worked, there is a very specific reason for this. And in this video, I'm going to show you exactly what that is. There are two critical things that almost every patient is missing that causes their treatments to fail. And once you understand these two things, everything changes. In this video, you're also going to learn the exact 5-step approach that I use in my clinic that has helped hundreds and hundreds of patients with L4, L5, and L5S1 disc bulge and herniation and disc injuries to reduce their back and leg pain, return to normal life, and avoid surgery altogether. So keep watching to learn these 5 treatment steps. Hi, I'm Dr. Walter Salubro, a corrective care chiropractor right here in Vaughan, Ontario. And in this channel, I share tips and strategies to help you relieve pain from chronic spinal conditions, improve your posture, and live a full and active life again. Now, if you're new to this channel, go ahead and hit that subscribe button, smash that subscribe button, show some love, and join my channel to learn some of these amazing strategies that I offer on a weekly basis. Now, before I dive into these 5 steps of the treatment program that we do for our disc herniation patients, you need to first understand what's happening inside your spine, inside your body when there's a disc injury, like a disc bulge or a disc herniation. I'll use my handy spine model here to demonstrate. First of all, the first thing you need to know is that most disc injuries is not because of an immediate traumatic situation or event. It's not because of an injury like a car wreck or a fall or a sports injury. These things do happen, but that's not the most common reason why we see disc injuries or disc herniations or disc bulges. The most common reason is because of some type of spinal distortion, alignment distortion of the spine, or even posture that over time accumulates and damages the annular fibers of the discs. Eventually the disc bulges and herniates and causes all sorts of problems like back pain, inflammation, and leg pain, okay? So a lot of times it's an accumulated effect over time. What that means is this. So let's look at what normal is first. This is a lumbar spine model, and in a moment I'll show you what a full spine one looks like in a moment. But from the front, the spine is straight, okay? So straight. From the side has an elliptical shape curve. This is the lumbar spine. So there's 5 vertebrae in between the discs. When it's in a nice alignment, straight from the front, elliptical shape curve, more curve at the bottom at L4, L5, L5S1, then the weight distribution, the load of your body on the lumbar spine is distributed equally in the manner that it's designed to be absorbing that load and distribution. The problem is when the spine shifts out of alignment. It can be flattened out like a straight lumbar spine. It could be a scoliosis or a lateral shift. There can be a rotation in there. There can be just 1 or 2 segments out of position. It could be a sacrum that's tilted or kind of in an oblique fashion, or pelvic tilt, or a short leg contributing to that. Then now that's going to create a distortion on that disc even further. So look at this. If you're tilted this way, and it's putting distortion here at the L5 disc on the one side, over time that's going to irritate those fibers, going to break them down, and then cause the actual disc to bulge or herniate. Now, oftentimes it herniates backwards, called a central disc bulge, or lateral, posterior lateral, or it goes right into the lateral recess. The disc injury in and of itself causes inflammation, local pain, but when it begins to irritate the nerves like that one there, not just going to cause local pain irritation, but shooting pain right down into the legs. So the sciatic nerve, which is a common pathway for this nerve injury, this nerve pain, is formed from the L4 nerve, L5 nerve, S1 nerve, and some of the other sacral nerves, goes right into the pelvic region, out to the buttock, in the back area, back down the thigh, branches out into the legs, into the toes. So when these nerves are irritated by disc herniations because of a distortion on the spine, I'll talk about this a bit more in a moment, it's going to irritate the nerve, travel down the sciatic nerve, and cause all sorts of problems with the leg. Not just numbness, tingling, but shooting leg pain, burning, calf pain, numbness, tingling around the lateral part of the foot or the bottom part of the foot, and in between the first and second toe, the web of the foot, and of course back pain as well, and distortions of posture I've seen with a lot of our patients. Okay, this distortion oftentimes is not identified, and because of that is not corrected, and that's one of the main reasons why a lot of patients that I've seen that come to us from other clinics have had treatments that have failed. And there's 2 main things about this. Number one, a lot of them come to us from different therapy offices, physiotherapy or even chiropractic offices, and one of the first things they're told to do is strengthen or rehabilitate their back with core exercises. Now, core exercises are not bad, they're just given at the wrong time. When you have an acute injury, a disc flare-up, leg pain, your posture is distorted, you can't get started with core stability, planks, bird dogs, side planks, bridges, dead bugs, McGill curl-ups. You can't do that stuff just yet. Stretching, right? You have to reduce the irritation, inflammation, and also work on the structure before you can get working on the function. So that's the biggest mistake. And if that's been your experience, it's not your fault. That's what you've been told. But you're going to learn differently inside this video. That's number one. So we do give those core stability, strengthening exercises later on. I'll talk about that in our 5 steps in a moment. The second mistake that I see, and again, it's not your fault if you've been through this, is a classic one. People come to me, they know they have a disc injury, disc bulge herniation. It's been identified by MRIs. They come with their MRI paper on hand. Maybe they had a lumbar x-ray done, maybe not, but they know they have a disc injury or disc herniation, disc bulge, L4, L5, L5S1, but they never had the rest of their spine checked. Why is that important? Because you're not an individual with only a lumbar spine. You're an individual with a full spine from neck right down to the sacrum and pelvis. So the full spine should be straight from the front and have these natural lateral curves from the side. And if any part of that spine from top to bottom is out of position, it will put abnormal loads of stresses at the lower back. So someone may have a posture that's bent forward, their spine's flexed forward from the top. The lumbar spine may actually be in pretty decent alignment, but that extra weight distribution off center preloads that lower lumbar disc even further, and over time causes damage and disc degeneration. If you never correct the upper part, then the lower part never will improve. So what we do differently in our office is we do full spine x-rays, which gives us a whole different picture, a whole picture of your entire spinal alignment from the front and from the side. Some people have a distortion like this off center, and they have a distortion off center like this, and a distortion off center like that. There's no way the lumbar spine and this injuries in the lower lumbar spine are going to improve without looking at the full spine and correcting the full spine. So don't start with core exercise and stabilization right away until you do the structure correction, and then you need a full spine assessment on x-ray to determine what the structural distortions are. Having said that, let's dive into the 5 steps that I've used with hundreds of my patients in my office. I'm located in Vaughan, Ontario, Canada. Hundreds. Without any fancy decompression equipment, been able to not just reduce the pain from a lumbar disc herniation and or disc bulge, but also reduce the leg pain and also improve the posture, mobility, functional aspects of people's lives and daily livings, and of course avoid surgery. So we'll start with those 5 steps next. So step number 1 is chiropractic spinal adjustments. You need to get the spinal distortions that are affecting the disc and injuring the disc over time corrected and stabilized. Without that, the outcomes are going to be a lot slower and maybe not as positive. Why is this important? I talked about earlier about spinal distortions. There can be local distortions in addition to global distortions. We'll talk about global distortions and misalignments in a moment. That is part of the process of correction as well. But if there's a distortion here, a rotation of the spine, a tilting of the sacrum, all this is locally distorting the structure of the disc as well. So we have to improve that with spinal adjustments. And spinal adjustments does many things. Number 1, it improves the local function of that vertebra, those joints, okay? The L4, L5, L5S1 joints, and also the sacrum, the SI joint. When the functionality of that joint is improved, then there's little irritation that's building up in that one area. So now, because there's little irritation, the inflammation is beginning to subside. Because the inflammation subsides, the swelling around the nerve subsides, and the pain also subsides. So that's very important. And neurologically, you're getting a lot of good feedback into your nervous system and a lot of response back to that area. So it's producing a healing effect from a biomechanical and neurologic way. So you need to get the spine adjusted. That's the first thing that we start with. And we don't just focus on that one area. We do sacrum, pelvis if necessary, mid-back, and neck. It's full spine adjustments. And people ask me, well, do you adjust the L4, L5 disc if it's herniated, or the L5S1 disc if it's herniated? No, sometimes we stay away from it. If you're poking in there and it's really hurting and it's inflamed, we don't have to adjust that. I've helped many people just by correcting the sacrum, which is where the L5 disc sits on anyways. If you correct the distortion of the sacrum, you're improving the actual anatomical and biomechanical position of where that L5 disc is being situated, and that's going to help in and of itself. So chiropractic spinal adjustments, chiropractic sacrum pelvic adjustments are super important, and that's what we start with all our patients. Step number 2 is now we start moving our patients into what's called structural care or structural rehabilitation or corrective care The main technique I use is called chiropractic biophysics. I'm advanced, trained, and certified in chiropractic biophysics. There's a few chiropractors in the entire world that have advanced certification in this. Go look up their research at idealspine.com or cdpnotprofit.com, and you see that there's over 360 research publications behind chiropractic biophysics. Having said all that, what it does is it begins to look at the global subluxations, the global misalignments of the spine. So if there's a posture shifting forward or to the side or maybe an extension, all these are creating an insult at the lowest part of the spine, which is the L405, L5S1 disc. So we now apply CBP, chiropractic biophysics, corrective methods to restore that global alignment. And everything is done in what's called the mirror image position. There's mirror image exercises, mirror image adjustments, and mirror image traction, which I'll explain right now. What that means is this. Let's use the lumbar spine as an example. It should be elliptical. Let's say it's distorted and it's flattened out. That's going to cause an insult on the lower lumbar disc and cause it to wear and tear over time and cause all sorts of problems. I've had many patients come in with disc injuries, herniations and bulges, and leg pain because they had a straight lumbar spine. So we need to exercise this into a lordosis with pro-lordotic style exercises, extension exercises. And we exercise it to improve the muscular strength into that position. That's number one. Number two, I can adjust the spine with my drop tables or instruments into the extension position to induce a biomechanical and neurologic reset into that extension position as well. And all that's favorable for the herniated disc anyways. Extension is great for herniated discs in the lumbar spine. And then lastly is we place the spine on an actual dental, which is a roll underneath that gets the spine to actually bend into an elliptical position. If you look at the very top of my shelf, the yellow one right here, that's an example of the lumbar spine on a dental where the spine is being bent into a mirror image traction position. So there's mirror image exercises, mirror image adjustments, mirror image traction that forms the full chiropractic biophysics corrective care protocol. And that's going to be done over a span of at least 12 weeks at 3 times a week. And we start that after we did a couple of weeks of spinal adjustments to calm down the inflammation, irritation on the spine, and then we transition patients into corrective care. And I can tell you that's been one of the main things that's made a massive difference for a ton of our patients that have had injuries with their L405 or L5S1 disc area and leg pain that have had treatments that have failed elsewhere because they're either done out of order or never really addressed from a full spine corrective perspective with corrective techniques like chiropractic biophysics. Step number 3 is we're going to start introducing mobility exercises specific for the lower lumbar spine at L405, L5S1. And one of the exercises and tools I like to use the most for my patients is called a wobble chair. Now this is actually a portable wobble chair, and I'll show you a video here on the screen on how this is being used. So the person is on a chair obviously, so I'm just showing you here. The person sits on there, they're facing that way and their legs are down, and they begin to wobble on here. You'll see the video on your screen in a moment. And inside here there's a pivot. So basically this wobble chair, inside there you're pivoting on this in kind of a figure 4, figure 8 orientation, okay? And what that does is it creates movement in the lower lumbar spine. So if you're pivoting and wobbling on there, you're creating mobility in that lower lumbar spine. And of course, it's not done at the beginning when it's really irritated and in pain. It's done later on when the inflammation's calmed down. That's why it's done at a certain time. And when there's movement in the lower lumbar spine, not only does it feel good, people often find a nice sweet spot where they're relieving the leg pain as they go in that movement as well, but it's creating what's called a process called imbibition. Imbibition is a drawing in the fluids and a flushing out of materials that are causing irritation and inflammation from the injury. And imbibition is good for you. We need movement to create imbibition. Your discs are avascular. They have no blood supply, so you need movement to create a drawing in of nutrients and flushing out metabolites to that area. So doing a wobble chair exercise is one of the next things that we do, and that all my disc bulge patients get them, and they find tremendous relief from that. Step number 4 is now the functional core exercises to strengthen and stabilize the lower back. This is now when I teach my patients to get into things like bird dogs and planks, prone planks, even full planks if they can, or side planks, McGill curl-ups. These are all core stability exercises that I introduce later on, a lot of times a month or even 6 weeks into care. Because now we've decreased the inflammation in the lumbar spine and the discs and the nerves. We've improved the mobility through chiropractic adjustments. We're starting to do mobilizations with the wobble chair. We're introducing structural corrective care. A lot of good things are happening that are providing the foundational support. Then now we can add the muscular core strengthening stabilization exercises that I usually add later on. So we do introduce that as well, but not at the beginning, later on in the process, and that helps to solidify from a functional perspective, a lot of the corrections that we're doing from a structural perspective. So I'll get into the fifth one in a moment. So let's just summarize where we're at so far. Number one, we start with chiropractic spinal adjustments to introduce motion, release the restrictions and the distortions in the lumbar spine, improve biomechanics and mobility locally around that disc and nerve. Number two, we introduced structural corrective care, full spine structural corrective care as needed for the patient. Number three, we introduced lumbopelvic mobilization through the use of a wobble chair. And number four, we started to add the core strengthening stabilization. Okay. Now, at this point, people ask me, how long does it take for things to get better? Well, everyone's different. It can take up to a year to see good improvements from a disc injury, but oftentimes with remodeling and repair over time, but oftentimes people are experiencing anywhere from 50 to 80% reduction of their symptoms in the first 12 weeks. Now, which is 3 months. Now, that's different from person to person. We got the people that experience relief early on, and some people take a little bit longer. So if your problem's been chronic, it take maybe 6 months to see improvements. But we do have a process that moves people along that path, okay? So the next one is number 5. Once they start to feel better, which means they're improving with their posture, their mobility, their flexibility, the pain's reduced from a 10 out of 10, 9 out of 10 down to 1 out of 10 or 0 out of 10 or even 2 out of 10, somewhere that's manageable, and their posture's improving, then now we have to introduce what's called maintenance care, supportive care. We graduate them out of corrective care based on their outcome evaluation, and we move them into what's called supportive maintenance care. That may be once a week of adjustments, once every 2 weeks, eventually once every 3 weeks. You need to maintain the correction of your spine if you want your spine to be healthy for the long run. Treatment is not just a matter of short-term objectives to get you out of pain. That's important. It's about long-term outcomes and stabilizations that can support you for the rest of your life, because your spine's with you for the rest of your life. So we introduce what's called maintenance care as level 5, and a lot of our patients love that. I've had patients with me for 10, 15 years that come in as part of their health requirements and personal choices for healthy lifestyle, that they get their chiropractic checkups every once a week, twice a week, or 3 times a week, depending on what the patient wants. So those are the 5 steps of our program of care when it comes to helping people with disc herniations, disc bulges, sciatica, leg pain, all these types of things associated with disc injuries. And if you're missing any one of those, then you should find a chiropractor, corrective care chiropractor that can help you with that. If you have any questions about any of these steps, do ask them in the comment section below. And if you're looking for a corrective care chiropractic biophysics doctor in your area, let me know in the comments below, and I can refer you to an online directory, trained and certified chiropractic biophysics doctors like myself, that hopefully you can find in your area, and you can just put in your zip code or area code that you can search for one. So let me know in the comments below, and I'll send you that directory with a reply. And remember to subscribe to my channel if you like these videos and you want more information. And if you want to see some of this material in action, I'll point to you a video over here where you can see how we apply these techniques to a straightening of the lumbar spine situation, these corrective techniques, which is often associated with disc injuries and disc bulges anyway. So go watch this video right over here to see some of these corrective traction techniques in play.